Good day, friends, and a warm welcome to the 50th episode of 4D. 4D stands for Detailed Discussion and Dialogue in Persons with Diabetes. And it's detailed discussion and dialogue in Indian diabetes, in persons from India, our fellow citizens, men and women, boys and girls of our great country. Now, today is our 50th anniversary, and 50 is a very special number. 50 means midlife maturity. We've come of age. We thank all of you who've been part of 4D. Thanks to you, we exist. And thanks to you, we grow. We grow together actually in this endeavor to ensure that good quality diabetes care reaches each and everyone in our country. So there is a level of maturity. And because we are 50, we call it midlife maturity. We can feel proud. We can say that we want to relax. But that's not true. Along with midlife maturity, we exude what we call maiden charm, maiden enthusiasm. And just like a maiden, a young person, a young youth who has lots of energy, boundless energy, enthusiasm, we continue to have the same. Now, one of the reasons why this midlife maturity and maiden charm coexist together is because of our moderators. Our moderators who've done a great job of steering us through the last 1 year. So allow me to welcome our moderators. A warm welcome to Professor A.K. Das, our teacher, the Dronacharya of
Thank you.
Indian Diabetes from Pondicherry. Warm welcome,
Thank
sir.
you. Thank you. Thank you, Sanjay.
Thank you, sir, for being with us.
Thank you. So nice of you.
Also welcome Dr. Sachin Mittal from Chandigarh, a dynamic dude of Chandigarh. Now, Chandigarh, we know, is famous for many things. So welcome to Dr. Sachin Mittal as well.
Thank you so much, respected sir. It has been such a pleasure, and good evening, Dr. Akedas. It has been
Thank
such
you.
a pleasure to be a part of 4D, that is detailed discussion on Indian diabetics, and the dialogues have been absolutely amazing. The audience has been absolutely great, and it has been a wonderful, wonderful opportunity and great learning for all of us.
Another moderator who has helped us is Dr. Prashant Arun, someone who has been with us in this journey. Warm welcome to Dr. Arun as well.
So, hi, I'm Dr. Prashant Arun, consultant physician and diabetologist at MB Hospital for Diabetes. We had a wonderful discussion in the 4D session. We had various doctors who took part, and various doctors from all over India shared their experience on dapagliflozin, sitagliptin, metformin, triple drug combinations, double drug combinations, and they were telling all the clinical challenges that they were facing. They were sharing their experiences on these molecules. So definitely it was wonderful event, and it was able to educate a lot of people.
Thank you, Dr. Prashant. Dr. Das, sir, how frequent is it for such consistency to occur? You have so many decades of experience.
I think, Sanjay, I must tell from the rooftop, it is absolutely rare feat that you have done. To continue consistently 50 episodes is a feat that many have not yet done it or have done it only partially.
I am reminded, sir, of this pyramid of success in practice. So, everyone who is listening to us, colleagues, friends from across the country, and there is this pyramid that I was taught when I was in medical college. At the bottom is availability. You must be available. Let's look at this pyramid from an education point of view, Dr. Sachin. So, at the bottom is availability. Above that is affability. Affability means how friendly you are, how flexible, how approachable, how authentic you are. And then at the top is ability. Let's ask Dr. Sachin Mittal first. Availability, affability, ability. How have all our speakers fared on these three domains over the past 1 year?
I think over the past 1 year, all three domains needed to be together in sync for the wheel to run in a smooth manner, and that's what all the speakers have done. If I go from the reverse order, the ability has been par excellence. These have been eminent diabetologists and endocrinologists from the length and breadth of our wonderful country who have contributed immensely in disseminating the information so that the eventual patient care of patients with diabetes in our country, that is Indian diabetics, can improve, so that the morbidity associated with multiple complications with diabetes goes down. And if somebody has the complications, if we can prevent them, or if somebody has the complication, if we can treat them in the most logical and ethical manner. So ability has been extremely great. I would rate it on a scale of 10 to 10 to be, if I'm allowed to make it 11 out of 10. Affability as well as availability, these are the virtues without which the ability also does not exist. So if the speakers, they had not given us their gracious time, and they have, it would have been very difficult for us to make this consistently happen. It would have not been possible for 4D to complete even 25 episodes, let alone the 50th episode. So we are immensely grateful to all our speakers who have contributed so much in making 4D a success.
Dr. Das, sir, Dr. Sachin has just converted the pyramid into a wheel. So everything coming together, whichever side the doctor is on, whether the doctor is speaking in a webinar or listening to a webinar, the doctor should be available, affable, and able, capable. Sir, your take on this, all the three A's together, how have things changed over the past 20 to 30 years? And how have they changed over the past 1 year?
I think, Sanjay, it's a very thought-provoking question. Now, as such, one has multifarious activities, but we are always available for the one we love most. We love most the person behind it, his affability, his love, his tenacity of purpose, dedication. Third, we have also the people who are capable of delivering on the Indian diabetes. To make a long story short, I must tell you that we have to deal with our diabetics. Therefore, the knowledge that has been disseminated through this platform of the peculiarity of Indian diabetic. Many, Sanjay, you are the author, the festivities, the sports, a particular day in the life of a diabetic in India, the diet, I know what not. The various aspects that we have discussed are absolutely fabulous treasure in the hand of our audience. And in our own hands also, we prepared for that episode to apply it, to implement it in our patients. Therefore, we must be global. At the same time, local problems has to be solved locally. I strongly believe that, Sanjay. Therefore, the power and the amount of knowledge and the wisdom packed in these programs are fabulous, unparalleled, and that has driven our speakers to be available. They love the program hosted by, I will not take the name, but you, Sanjay, you command love without your knowledge. And and they are the people who is who in the list of diabetes endocrine in India, and they have delivered the goods in the manner it was expected to deliver.
Thank you, sir. Dr. Sachin, our topic has been 4D. Now, D is a very dynamic kind of a word. Dynamism means that you can change depending upon the situation around you, depending upon the environment that you sort of find yourself in. Now, the Indian physician who manages diabetes, how versatile does that physician have to be? Is diabetes always a chronic disease? Can it be acute? Is it always a happy disease or unhappy? What are the various kind of hats that the Indian physician has to wear within one day of his or her practice?
Thank you, sir. I'm so glad this question came about. So yes, it's very, very true that the Indian diabetologist needs a lot of dynamism. So dynamism, that is a D, is needed in all diabetics, for especially in our country, because we have various situations which we encounter situations where people have economic issues. We encounter situations where it's a disparity in terms of sometimes people have no challenges, sometimes people have a lot of challenges of even sticking to the basics. Sometimes everything is available, sometimes nothing is available. Sometimes you have to treat patients on the go. There is a paucity of beds in some places. Healthcare is stretched, the investigations are stretched, and sometimes there is everything available and you have to go according to that. So the same physician needs to wear different hats according to the situation of the patient, according to the availability of medications, according to the availability of investigations. So for instance, in a remote setting, if there is a child with diabetes, the physician might need to rely on a clinical acumen many times without the presence of an arterial blood gas, without the presence of acute investigation, and maybe follow the PrEP protocol if the clinical acumen is suggesting like a diabetic ketoacidosis, right? And a lot of parameters according to the patient will be managed basically on the clinical judgment and the clinical acumen of the physician. And on the other hand, there may be a situation where the periodic, 1 hourly insulin infusion pump is a very easily availability for some situations, and the same physician might be in a situation where that might be possible. That is one situation. Sometimes we have a situation where there is a paucity of medication. So for instance, where I did my DM, the patients which used to come to me, they only said that whatever medication you can give us, we can take only that. So whatever medication was available in the government supply, we could give that, right? So insulin also, whatever was available, because those was the socioeconomic strata where, medication was something which was there important for them, but not the most important thing for them. The most important thing for them was feeding their family, right? Making sure that their children are looked after well, right? So that is a situation where we have to manage diabetes in such situations, and it doesn't exactly go to the guidelines in that situation. So that is why the dynamism is very much needed for a lot of physicians who are managing patients with diabetes in our country.
Thank you, Dr. Sachin, and hats off. Salute to everyone who is logged in today. Salute to everyone who is actually taking diabetes care to the masses. Without you, we cannot succeed in our aim. Dr. Das, sir, we are called by other countries as the diabetes care capital of the world. As the diabetes capital of the world.
Yeah, I think you have told the thing which is in the minds of everybody. There is no great pride to be called diabetes capital of the world. On the other side, there is a great deal of urgency, responsibility, call to duty, if we call it the diabetes care capital of India. I must tell you one thing, Sanjay, that I read recently an article called Think Globally, Act Locally. Indian diabetes needs Indian solutions. But the author has hastened to add that does not mean shutting our doors, but the adaptation, the customization, the Indianization of the investigations, what Sachin told just now. The management guideline is of absolute importance. So I think what is most important today is that we have to produce results and outcomes. The way the diabetes knowledge has exploded, which you referred to, Sachin referred to, is mind-boggling. At the same time, we have to also achieve the outcome that is expected to come out of that knowledge, like H1C reduction, at least 1% in a specified period. The freedom from complications, the freedom from comorbidities, the caring for the not only comorbidities but multimorbidities. The fact that the detection of the cases are paramount, and we can proudly say that we detect that. We have a universal detection program, universal screening program. We have a program for the diabetic mothers. We have to have that pride in us that we have to produce results. We have to provide the state-of-the-art care at the most affordable price. I call it 4A's, Sanjay: appropriate care in the affordable price, available and accessible. If we can do that, we can really be called the diabetes care capital of the world.
That is our aim, sir, and thank you so much for leading the way. When we have senior visionaries like Dr. Das, sir, then automatically the path is shown to us, and then we move ahead with it. Literally. Dr. Das, sir, started this series. So, Dr. Prashant, what's your take on this? Dr. Prashant, when we move on this path, when we journey towards any aim, of course, the aim, Dr. Das sir has told us, is good glucose control. The aim is becoming the diabetes care capital of the world. But in any journey, you need a travel companion. You need a humsafar. Is that not right? So, Dr. Prashant, do you think we can manage diabetes alone?
Letting them know that there are drugs that can help prevent complications of diabetes like the diabetic retinopathy, nephropathy, and the macrovascular complications by keeping the diabetes well under control. Because in the Indian population, people are unaware either they have diabetes or they are unaware of the complications of diabetes. So through this program, we were able to educate a lot of people and help them diagnose their diabetes, get proper treatment, and take care of their health and avoiding the complications. And definitely now talking about the triple drug combination, because people with diabetes usually they already have either a cholesterol tablet or a BP tablet or a thyroid tablet. So they take a number of pills. But when we have this triple drug combination, it actually reduces the pill burden for the patient. So the patient adheres to the medicines and takes their medicines continuously. Number two, people don't like taking many medicines. So in such scenarios, definitely this triple drug combination and the double drug combination definitely works. Next is the medicine expense. The expense of the medicine also comes down when it becomes into a double drug combination. So the medicine expense also comes down, because in India, many people are not able to afford the right medical treatment. So all this was addressed. It was done really well. And thank you so much for keeping me involved in this program.
Thank you so much, Dr. Prashant. Dr. Shela, madam, your take on this. Who is the captain of the ship when it comes to sailing the seas of diabetes care? Is the captain Dr. Das, sir? He is our teacher, our guru. Is it maybe Dr. Prashant, Dr. Sachin, or myself? Is it the doctor who is sitting in his or her chamber? Or is it the person living with diabetes? Who is the captain of the diabetes care ship? Now we have so many opinions, so many ideas coming up, and see, our mind is expanding. What we think of that diabetes is just a very dry kind of a subject, maybe one chapter in Davidson or Hutchison, not even one chapter in Hutchison, and just one chapter in Davidson. It's not like that. It's a very live subject. It's vibrant. It keeps changing. There's a lot of fluidity with it. So just like we have fluidity in diabetes, we also have fluidity in terms of diabetes management. Now, FTCs, fixed dose combinations, are something that are a contribution from India. Let me tell you about the first polypharmaceutical drug that was prepared in the world. This comes from my state, from Haryana, and we are very proud of it. So the story goes that long, long ago, once upon a time, there lived a rishi called Rishi Chavan. Now, he was a bit elderly, but he was happy with life. Then he got married. And then suddenly he realized that he is not so happy with life. So he sent an SOS to the Raj Vaidyas, who were the Ashwin brothers. So the Ashwin brothers responded. They came to Rishi Chavan's ashram, which is located on Dhosi Hill. Dhosi Hill is in Narnaul district in southern Haryana. And there they produced something called Chavan Prash. Chavan Prash was given to Rishi Chavan, and then it seems it did wonders, and then he lived happily ever after, and he had a very happy married life. So that is a good thing about FDCs. Chavan is an FDC. Allow me to point out here that Chavan is made with ghee. Each and every spoonful of ghee, which has 5 grams of ghee, it will have 45 calories. So whether sugar-free Chavan or diabetic Chavan is being marketed, please tell your patients not to take that. It will ruin their glucose. The glucose levels are going to go haywire. If the patient says, no, sir, I have to take this medicine because I need it, then you can say, okay, you buy one packet, but you check your glucose every day for the next week. And if you think glucose levels are going wrong, please stop the drug and let someone else in the family take it. And whatever indication you have, whatever kind of weakness, whatever kind of shortcoming you have in your personal life, we have other drugs, we have better drugs to give you. Some of these drugs are FDCs. So, Dr. Sachin, what is the advantage of having an FDC, a fixed dose combination, when you're managing diabetes or hypertension?
So, the most important advantage which I feel while managing diabetes of FDCs is that it leads to better compliance. We must not forget that when we have a patient with diabetes, to give a holistic care, the patient usually requires to have a multiple kind of medications, sometimes on prophylactic basis, sometimes on treatment basis. So we are looking at A, B, C, and W. That is A for A1C, B for blood pressure, C for cholesterol, W for weight. So most of these things it eventually requires a lot of pills to be taken for a large number of patients with diabetes, which over a period of time, the patients can become fed up with that. So, and they feel that, what has my life become? मैं सुबह से लेके शाम तक I'm only having pills, 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 and nothing else, right? So, it basically helps them take care of that aspect. And, the combinations, the fixed dose combinations decrease the pill burden, ease the patient's life, lead to a better compliance. Any medication is effective only if the patient takes it, and also patient takes it in the right frame of mind. So that's the advantage of fixed dose combination. It leads to decrease in pill burden, better compliance, and also economically also they are better for the patient's pocket, because many of the patients, they are paying for the drugs out of the pocket in our country, and economically also it makes sense to use fixed dose combination for large number of our patients.
Thank you, Dr. Sachin. Dr. Das, sir, so many FDCs are available now. One of these is an FDC of sitagliptin, which is a DPP-4 inhibitor, and dapagliflozin, which is an SGLT2 inhibitor. What thoughts come to your mind regarding the benefits of such an FDC, dapagliflozin plus sitagliptin?
I think it's a great question, Sanjay. I will just add to what Sachin has just said. He beautifully said, I have coined a term called CCC. The FDCs are centered around compliance, which Sachin beautifully explained. It is convenient for the patient to take one tablet vis-a-vis 3 tablets. And third is the cost. When you have a FDC, the cost definitely comes down. Now, India has been the FDC care capital of the India. And the other thing is that the diabetic drugs work best in the submaximal dose. Many of the drugs, I think about 80% of oral antidiabetics, Sachin, am I correct? They act better in a submaximal dose. So combining them submaximally, we get the greatest benefit. Now, the question that you have asked, that how this fixed drug combination have revolutionized the diabetes management in India. I'll tell you, Sanjay, it's a simple story. Now, India has been fast in diabetes in many ways. You know better than me. One is in metformin. The second one is screening at 35, which American ADA has accepted last year. You were the pioneer in the psychosocial aspects, which you wrote, and then Americans adapted it. It is a pioneer in FCPD, model diabetes, diabetes and heart, which Dr. Tripathi wrote about. But what is the greatest gift of India to the mankind is the FDC. As I just now telling you in the meeting that we are having recently, the FDC has been adopted by the United Kingdom, in the United States, in Ceylon. Both of us are together in Sri Lanka. Remember, they are adopting the combination drugs with a welcome. The fact of the matter is that diabetes has about ominous octet, 8 defects. Now, dapagliflozin addresses 5 of these 8 ominous octets, and sitagliptin addresses 3 to 4. Therefore, Sanjay, I have no hesitation in saying with the absolutely loud voice that DAPA plus SITA stands out today as the most plausible, most sought after, most useful, most potent combination addressing the 8 pathological defects of type 2 diabetes. Therefore, to my mind, the question you asked, DAPA plus sitagliptin is a complete solution to type 2 diabetes.
Thank you, sir.
Thank you, Sanjay. Thank you, Sachin.
Thank you so much, sir.